Just don't say it faster when you're standing there.
Yeah, I will slow down. Susan Meyer, our CEO, apologized that she couldn't be here today. She wanted to go with silo and help get things resolved.
This one's not back.
And when you do walk up there, make sure you introduce yourself
Okay.
and all of that. So
Okay.
we'll have a logo there for you as well, but
Just raise your hand and I'll be asking questions too.
so the questions will be coming from Jared and
Okay,
myself.
great, thank you.
All right. You said, Doctor.
Well, good morning and welcome to this Facebook Live on the 27th of March. My name is Bob Lutz. I'm your County Health Officer. And I'd like to tell you that at this time we have identified 83 cases as of positive testing at this time. Obviously, many people are very concerned about the significant uptick in numbers, and I would suggest to you that this is a function of more testing. Just more testing being available at not only the screening site at the county fairgrounds, but again throughout our entire community. I think this gives everyone real evidence that COVID-19 is spreading throughout our community. And I want people to realize that these numbers will continue to rise. We oftentimes see this rise very quickly at the beginning of the outbreak, and we hope that as this outbreak continues, that trend will start to level off. But again, going forward, the expectation is that these numbers will continue to rise very quickly. We have the power to slow this spread, however. And that's where, again, I keep on coming back. As the governor stated the other day, stay home, stay healthy. Social distancing is key in this effort, in this community-wide effort. Again, it takes all of us. It's not just any one individual. It's all of us participating, working collectively together. Stay home, stay healthy. Social distancing has an impact. Irrespective of that message, however, there are individuals who need to get to work and, again, performing those essential services. And we know that one of the means by which people get to work is by using public transportation. They access health services. They go to work as an essential function. And they'll go to grocery stores or pharmacies. So now more than ever, we really need to ensure that our public transportation system is stable, sustainable, and accessible. STA is here to talk about its work and efforts to ensure the lines continue to run and that the health and safety of everyone who uses STA is ensured. Brandon?
Thank you, Dr. Lutz. My name is Brandon Rapez-Betty. I'm the Director of Communications and Customer Service at Spokane Transit. I want to talk to people today about the services that we have available during this emergency. Like in most other emergencies, public transit is an essential service to those who would otherwise have no means of transportation to groceries, pharmacies, medical appointments, and other important destinations. STA employees have demonstrated an honorable commitment to public service and our community by continuing to show up to work during this emergency. We see our coach and van operators as frontline heroes as they continue to serve those customers in need of transportation. Early on in this, STA immediately increased its disinfecting protocol on all of our vehicles. So for our buses and vans, they are disinfected each night. And starting earlier this week, we are implementing a secondary cleaning on as many vehicles as we can possibly get to. At the STA Plaza, we've closed all of the public seating and waiting areas, so it creates a walk-through only practice at the plaza. You can still access questions at customer service. They're behind a glass screen, so they're protected. The businesses, particularly Pizzerita and Subway, are restaurants, and they are open for takeout. And people have access to real-time information to see their arrival and departure times for the buses. So the building is open, but there is no waiting inside. I wanted to give an update on ridership. So on fixed route, the regular bus routes that we have throughout the region, we are carrying about 1/3 of our normal ridership. That's just over 10,000 rides per day. And on paratransit, we are down about 80%, transporting about 300 passengers a day compared to around 1,400 around this time last year. These ridership numbers do indicate that customers are adhering to Governor Inslee's stay home and stay healthy order. Earlier this week, STA CEO Susan Meyer signed an emergency proclamation, and that enabled additional emergency powers, and we've implemented safety measures from that. As of yesterday, Thursday, March 26th, we suspended fares. So all services, fares are temporarily suspended, and our goal is to reduce the number of transactions we have at the fare box with the coach operator. Most passengers will also board the buses through the rear door of the bus. Those passengers who do require mobility assistance can continue to use the front door. The intended effect of these two practices is to keep our coach and van operators healthy so that they can continue to drive the buses and provide transportation services throughout this emergency. Because we have additional capacity in our paratransit program, we've implemented a temporary program called Rides for Seniors. Rides for Seniors is for people 60 and over. We recognize that they are a vulnerable population and most susceptible to COVID-19. These trips are intended to be for essential travel. So this is to grocery stores, pharmacies, medical appointments, and to those who are still reporting to work. Schedule can be same day with 2 hours notice, or you can schedule a day in advance. Seniors who need assistance are able to take one companion with them on these trips. We're also going to be limiting the passengers per vehicle on our vans in order to maximize social distancing practices during travel. The service is offered 7 days a week. To speak with a reservationist, you can call 328-1552. That's 328-1552. You can learn about these details that I've discussed today and a lot more at SpokaneTransit.com. And thank you very much.
All right, first question, Brandon, if you'd like to stay there for one moment. We have a question from someone online wanting to know if there are going to be any changes in the service level from STA.
So recognizing that public transit is an essential service, and that by having the maximum number of buses out on the roads, we can maximize social distancing all of the buses. Our goal is to maintain service. However, we are monitoring ridership levels and our own employee attendance levels. And if there's a change in either one of those factors, that would be the trigger for a service reduction. We don't foresee one at this moment, but if we see one coming, we'll be sure to be communicating with the ECC and our communication partners.
Another question we have, when it comes to passes, there are a lot of customers that use passes specifically. Can you clarify some of the issues that you guys are working through and kind of let folks at home know what's going on specifically with bus passes?
Absolutely. So we've heard from a lot of customers in the last couple of days who see a lot of value in the passes that they purchase. And in the month of March, people's destinations were changed, and they didn't get the value out of the passes that they had purchased. We also have a lot of people who have already purchased passes for the month of April, and fares are suspended, and so they're feeling like their income is not doing what they need it to do. And so we're here to help those customers. And we are going to be replacing passes that were used for March or April. So we have a lot of different programs. So people need to speak to our customer service representatives to see what we'll do for their pass type. They can call 328-RIDE. That's 328-RIDE. And we'll help people out however we can with those passes for March and April.
And for the paratransit vans, I know what kind of, how many people you typically are able to transport using those vans. How many are you now with the social distancing now in play?
So because capacity in paratransit, we have the additional capacity. Some trips may be just the senior themselves, just the individual. If demand increases, we could have up to 2 or 3 passengers on that van, but the van normally seats 12 people. And so, we're going to make sure that we're restricting it to maximize social distance and keep those seniors on the van safe.
Now, is there a final message that you'd like to tell folks at home so they are aware of everything that is going on to not only keep them safe but healthy, but also the folks that work at STA as well?
Yeah, I had 2 messages. The first is that there is an order from the governor to stay home and to limit trips to essential destinations, so grocery stores, pharmacies, medical appointments, and work. And so to make sure that people have a destination for their trip. We are not in a position to have people riding the bus just to ride the bus, and so it's important that everybody have a destination in mind when they get on the bus. Second of all, thank your driver, thank your coach operator, and your van operators who are out there continuing to provide this service.
This question is for Dr. Lutz. Dr. Lutz, can you speak to those who have been tested and confirmed positive, what the impact has been on our Spokane regional hospital system thus far for patients with confirmed cases of the virus?
Yeah, so with respect to, as I mentioned earlier, we've had 83 cases that have been identified, and of those cases, a number have required hospitalization. The encouraging thing for me at this point is that the hospital capacity has not been tasked, it's not been taxed, and it's still very flexible. So for me, that's very encouraging going forward.
Perfect. Thank you, Dr. Lutz. And just in closing, you've been dealing with this for the last month now. At this stage of the game, is there anything that you want to emphasize more than anything else to our viewers out there as we close up today?
Well, I guess a couple of take-home messages from me for all of us out there. We're in this for the long haul. This is not something that we have to look at ending at the end of this month or in the next week. So I think, again, setting reality and looking at the fact that we don't want unmet expectations, and I think that's really important for people. Planning is essential, and planning does not mean panic. So again, I really encourage planning and preparedness. And then, again, coming back to the messages that we've been talking about since the beginning of this, we talk about something, if it's frequently touched, it's frequently cleaned. We talk about the importance of cough hygiene, and it's not this, but it's this. It's coughing into your sleeve, okay? So what we call cough etiquette. Social distancing does not mean social isolation. And so it's really imperative at this stressful time that we connect in as many ways as we can, assuring the fact that we are, again, practicing social distancing. And really, again, living by and following Governor Inslee's most recent message, staying healthy, staying at home, and I just add saving lives. Because again, we know that social distancing really does prevent illness, and social distancing will prevent individuals who are at high risk from getting the infection and possibly not doing well from it. So I think those are my take-home messages at this point. And again, I thank you for attending this Facebook Live, and we'll check in with you next week. Thank you.